Welcome to another lesson as we cover multiple sclerosis. What is multiple sclerosis? Well, multiple sclerosis is a neurodegenerative illness that causes voluntary muscular performance to be compromised and deteriorate. MS is an autoimmune disease that affects the brain and spinal cord's nerve cells. MS is a long-term condition caused by a genetic or immune-mediated attack or infection that causes myelin to be destroyed, a fatty protein that surrounds nerve fibers. As a result, nerve impulses are disrupted by demyelination. Plaques on demyelinated axons can prevent them from regenerating, resulting in irreparable injury. The optic nerve, cerebrum, brainstem, cerebellum, and spinal cord are the most commonly affected sites. MS can take a number of different paths. Relapsing and remitting is the most prevalent. Relapses and remissions are common with this disease, and the client may not be able to return to their prior level of function. The client's condition may deteriorate to the point of quadriplegia over time. MS is a progressive chronic condition with no known cure that worsens with time. Initial findings can be so ambiguous that it takes years to get a diagnosis. Some kinds of MS are more aggressive than others, and they might lower one's life expectancy. In most situations, this condition has no negative impact on life expectancy. Assessment. Risk factors. The onset of MS is typically between 20 and 40 years of age. MS occurs twice as often in females. The etiology of MS is unknown. There is a family history, first-degree relative, of MS in many cases. Research shows association with the interleukin, IL-7 and IL-2 receptor genes. Because MS is an autoimmune disease, there are factors that trigger relapses: viruses and infectious agents, living in a cold climate, physical injury, emotional stress, pregnancy, fatigue, overexertion, temperature extremes, hot shower or bath. Expected findings include the following: fatigue, pain or paresthesia, diplopia, changes in peripheral vision, decreased visual acuity, scotomas, which are patches of blindness and periods of total blindness, tinnitus, vertigo, decreased hearing acuity, dysphagia, dysarthria such as slurred and nasal speech, muscle spasticity, ataxia or muscle weakness, nystagmus, bowel dysfunction such as constipation and fecal incontinence, cognitive changes such as memory loss or impaired judgment, sexual dysfunction. Laboratory tests. Cerebrospinal fluid analysis reveals elevated protein level and a slight increase in WBCs. Diagnostic procedures. Magnetic resonance imaging, MRI, reveals plaques of the brain and spine, which is most diagnostic. Patient-centered care, nursing care. Nursing action include monitoring the following: visual acuity, speech patterns, fatigue with talking, swallowing, activity tolerance, skin integrity. Discuss coping mechanisms and sources of support such as family, friends, spiritual figures, and support groups. Encourage fluid intake and other measures to decrease the risk of developing a urinary tract infection. Assist the client with bladder elimination, intermittent self-catheterization, bladder pacemaker, Creday's maneuver, placing manual pressure on abdomen over the bladder to expel urine. Establish a voiding time schedule, every 1.5 to 2 hours initially, with gradual increase of the time interval for those experiencing incontinence. Monitor cognitive changes and plan interventions to promote cognitive function. For example, reorient the client, place objects used daily in routine places. Facilitate effective communication for dysarthria using a communication board. Apply eye patches to treat diplopia. Alternate between eyes every few hours. Teach scanning techniques. Instruct the client to visually scan their environment by moving the head from side to side. Exercise and stretching involved muscles but teach to avoid fatigue and overheating. Promote energy conservation by grouping care and planning rest periods. Promote and maintain a safe home and hospital environment to reduce the risk of injury. For example, walking with a wide base of support, assistive devices, skin precautions. Medications. Disease-modifying therapies. Reduce the frequency and duration of relapses. Interferon beta-1a and beta-1b injectable agents that, if used, should be started early in the course of the disease. Flu-like manifestations are an adverse event. Immunomodulators are used to prevent or treat relapses. Glatiramer acetate injectable agent. Teriflunomide, fingolimod, dimethyl fumarate. Oral alternatives for those who have experienced injection reactions. Prednisone, dexamethasone, or methylprednisolone. Corticosteroids are used to reduce inflammation in acute exacerbations and are administered in large doses over a 3 to 5 day period, followed by an oral taper with prednisone. Nursing actions. Monitor for increased risk of infection, hypervolemia, hyponatremia, hypokalemia, hyperglycemia, gastrointestinal bleeding, and personality changes. Dantrolene, tizanidine, baclofen, and diazepam. Antispasmodics are used to treat muscle spasticity. Intrathecal baclofen can be used for severe cases of MS. Nursing actions. Observe for increased weakness. Monitor for liver damage with tizanidine and dantrolene. Client education. Report increased weakness and jaundice to the provider. Avoid stopping baclofen abruptly. Carbamazepine. Anticonvulsants are used for paresthesia. Docusate sodium. Stool softeners are used for constipation. Propanthyline. Anticholinergics are used for bladder dysfunction. Propranolol and clonazepam. A beta blocker and a benzodiazepine used for ataxia. Amantadine, pamela, dalfampridine, baclofen, tizanidine. Administered to combat fatigue that can interfere with ADLs. Interprofessional care. Plan for disease progression. Provide community resources and respite services for the client and family. Consider referral to occupational and physical therapy for home environment assessment to determine safety and ease of mobility. Use adaptive devices to assist with activities of daily living. Refer to speech-language therapists for dysarthria and dysphagia. Emphasize the need to avoid overexertion, stress, extreme temperatures, humidity, and people who have infections. That ends the lesson on multiple sclerosis. Check out our other nursing videos to help make studying easier. Also, see below for useful links that take you to free NCLEX-style quizzes, nursing study guides, and more.